Women have the power to transform this world. We can end crime and violence if we all agree to do one thing: share. Let's share our wisdom, share our time, share our talents, share our finances, but most of all, let's share our love. This is the Female Solution.
Good evening. I'm Naima Latif, and I am pleased to be with you this evening, host of the On-Air Daily News Hour. Well, this is July, and July is National Mental Health Month. We're seeing so much mental illness in our society, but a lot of times people who are going through a mental health crisis get either misdiagnosed or they get judged as incompetent or simply not deserving of our attention because their behavior is a little erratic. And so often, people who are struggling with mental illness get punished as opposed to helped and treated with compassion. Mental illness has had a stigma attached to it for so many years, largely because of lack of understanding of what it is, and also because people tend to see those who are struggling with mental illness as having done something wrong, something to cause the problem, some kind of neglect. There was a time when families would hide someone who was known to be mentally ill in the basement. They'd be locked up and you just wouldn't even mention their name. It was that bad over centuries of time until we finally evolved to an understanding that mental illness needs to be treated with the same compassion as a physical illness. Well, today on our Mental Health Month beginning, we're bringing someone who can give us some insight. And we're talking about this in the On-Air Daily News. Some of the incidences that have involved mental illness that ended tragically because people didn't quite understand the situation. So we want to educate all of us so that we can have more compassion and respond appropriately. So I'd like to welcome to our show someone who has the skills to prepare us to recognize and respond in a way that's helpful. Rachelle Mitchell is a psychiatric mental health nurse practitioner. And as such, she has seen the gamut of the conditions that exist in our society that often get treated in a way that is not helpful for someone who is suffering from something that is really treatable. So let me welcome to the show our guest today, Rachelle Mitchell. Thank you for joining us on the On-Air Daily News Hour.
Thank you. Thank you.
Well, I'm grateful that you're joining us because there's just so much misunderstanding and so much misinformation. And even now, there's still a stigma attached to what's considered mental illness. But can you tell us exactly what is mental illness and how does it differ from, say, long-term depression after a loss that sometimes people have after a death or a divorce and they're really down and not themselves? But what differs between that temporary condition and mental illness?
Thank you for asking that. So mental illness is more in detail with an imbalance of neurotransmitters that are secreted in the brain. So that's going to be more of a situation that may need assistance with counseling or medications that treat the increase or decrease of neurotransmitters. So an example of what I'm talking about is depression. People are commonly understanding what depression is when they see it, and the decrease in serotonin or any neurotransmitter that has to do with depression is how we choose the medication and treat the patient. So that's one example. Also, exaggerating triggers and the environmental factors will also cause mental illness. So a lot of times when you see someone that are triggered by their environment, you see a lot of gun shooting out here. You see people with schizophrenia. Those are people that may be in an environment. You see them walking up and down the street. They may be in an environment that's triggering to them as well. With grief, it's more of a temporary situation where they've lost a family, a loved one, but they're high functioning still, and their self esteem is still intact. They usually have family members that help them cope, and they've learned how to use different interventions with coping mechanisms as well. But mental health is a little different. You may need attention, and you may need to have things ruled out as well that is not mental illness. So labs are done to support, is this truly mental illness or is this a thyroid malfunction, which can look like depression. Some people are deficient in vitamins, and vitamin D is an example that will also mask depression. So it's really important for psychiatrists or nurse practitioners and physicians to collaborate together, and we rule out before we truly diagnose somebody with a mental illness.
You know, it's interesting you mentioned vitamin deficiencies, because people often don't think something like that could affect behavior. Well, is mental illness something that is considered curable, or is it just expected people will be on medication forever?
It depends on what type of mental illness. So, and the type of person that you're dealing with. What did they go through? Is it post-traumatic stress, where that may be more chronic because of the triggers? And so that's when we would add adjunctive therapy along with medications like counseling that's more appropriate for that person. So it depends. It can reverse, or it depends on the situation. Schizophrenia, those may be more chronic. So again, it just depends on the type of mental illness. I have seen where people do well, particularly with depression. Bipolar disorders are also most times chronic, but the main thing is the compliance. And that's when you'll see the difference in the outcome is the support system, the compliance with medications, and also following up with your primary care.
Now, there are a lot of families that have people that are drug abusers, alcohol abusers, and maybe they are chronically. And I bring this up because, you know, we've got a holiday coming up, and people are notorious for getting drunk or high and out of control during holidays. And sometimes their behavior can turn violent, deadly, destructive, and all these things. And maybe the behavior is habitual, like you mentioned, triggers. Something happens, something triggers them deciding to get drunk. Maybe it's argument with a supervisor at the job, or some other kind of thing, but it's a habitual thing. Like, okay, every week they go through this, and then they go through this drunken rage, and when it gets to that point, is that considered mental illness, when even though it's chemically induced, but it's habitual behavior and it's out of control? Is that considered a form of mental illness?
Okay, so two things. When you mention alcohol, let's separate social drinking, where the person is drinking responsibly. So we want to rule those people out. They're drinking responsibly. They know their limit. They're not driving recklessly. However, you'll have someone, like you said, they may be drinking to cope. People have different coping mechanisms through how they were raised. It's genetics that play into it, and environmental factors. And again, one of the things that come into play with alcoholism is increased dopamine. That neurotransmitter has to do with reward systems. So every time someone does substance abuse, they're getting a reward system to stay addicted. So yes, I would say that's a mental illness, because then it leads to anxiety, hallucinations, illusions, anger, and other chronic conditions that lead to now medical conditions like liver failure. And so, yes, it can turn into a mental illness, but people have to understand that the brain is very much involved with this as well, with the release of neurotransmitters, environmental factors. So again, another factor with alcoholism is not just the increase of dopamine, but also your GABA. I don't know if people have heard that, but GABA and glutamate also are involved with alcoholism. So glutamate is an excitatory neurotransmitter that gets us excited. These are our party people that you see that are very elevated, and they get you smiling. But what happens with alcohol, it actually inhibits memory. This is the blackout period. These are the people that pass out. And so GABA is increased. So those are the issues that come into alcoholism, that people are saying, oh, he's just an alcoholic. There's reasons for that. So we have to support people who are addicted to substance. I try not to say certain words that are offensive to people who are addicted. I like to say the word substance versus they're on dope. They're increased alcoholics, or he's just a drinker. Those words can be kind of offensive to that population. So we try to support them and use the word substance, or we would use the term that they're actually addicted to.
So what are, just so we know, what are the offensive words that we should probably not use when addressing those kinds of behaviors, substance?
Well, just the terms like dope fiends, stuff like that, or she's cracked up. We just use the street term, that part. Yes.
Dope dead,
yes.
drunkard, those kinds of things.
And the reason I say that is because when people judge, they're usually judging from a standpoint of their success. They're judging on what they're capable of doing when they're stressed out. But we all know, if you take away what you're able to handle, or you take away your support system, what are you left with in your crisis, is what I'm trying to say.
Yes. Well, I do understand. And how we say things does indicate whether or not we're showing proper compassion for people who really are struggling with something they don't have the power to overcome without help and support. So we're going to take a quick break and come back, and then we'll take a look at exactly what are the signs of mental illness. And can you tilt down a little bit on your top of your laptop, just so that your chin doesn't hit your name there? Yeah, there we go. Yeah, and we'll be right back after this quick break. And we want you to stick and stay. Don't stray away. We're here with Rachelle Mitchell, who is giving us some real insight about something that is all too common in our lives, mental illness. And this is Mental Illness Awareness Month. So we will be right back after this break. So stay with us.
Thank you.
Great day. It's your girl Asada here to introduce a new female solution show called Asada Says. That's right. Every month we're going to talk about everything I am, from cryptocurrency and financial security to good health and parenting strategies. Come on and talk with me every Tuesday morning from 7 a.m. to 8 a.m. And let's do that thing the way Asada says it should be done. See you then. Peace, right here on the Female Solution.
In which we're doing this documentary for, Douglas Robinson, Your Death Will Not Be in Vain.
He was a heck of a great dude.
And I love Doug. Doug loved me.
Just being around him, he had a good spirit. He was a healing person.
They are there.
Get SROs back.
When you give to the poor,
should not be forced out of their neighborhoods when it goes through a period of transformation.
Because there are too many people who are losing their homes to taxes because they can't pay a $1,000 tax bill.
And we are back. You are watching the Female Solution Global Broadcast. I'm Naima Latif, and this is the on-air daily news hour. And we are taking a look at this month as Mental Illness Awareness Month. And we've got with us someone who is an expert to give us some insight. Rachelle Mitchell, who is a psychiatric mental health nurse practitioner, sees many people who are struggling with recovering their mental health. So can you give us a description of some of the behaviors? How do we recognize mental illness? What are some of the signs, some of the behaviors that are common?
Well, some of the common signs and symptoms are withdrawn, being aloof, wanting to be alone in the room for several hours at a time, decreased appetite, energy. Sometimes patients will overeat is also a factor. You will see them decrease in their activities of daily living, poor motor skills. So it just depends, again, on which diagnosis they've been given. But most times it's decreased function in their activities, decreased thought process and concentration and so forth. Those are also signs of mental illness. One of the things I always like to talk about is, particularly with depression, when you talk about what are the signs and symptoms, one of the things that families need to keep in consideration is when you see your loved one giving away things, those are signs that be watchful for what we call suicidal ideation or suicidal thought process, because they're giving away things with the intent that they're going to harm themselves. So you may be very well just accepting a gift where that person was majorly diagnosed with depression, and you see them with this upbeat attitude, this sudden energy out of nowhere. Those are signs of something to really look for and have that person more monitored by the family or caregiver.
Ooh. Now that's something to consider. I've known people who have had family members that committed suicide.
Mm-hmm.
And sometimes there was no sign of the depression at all, or it wasn't recognized. And sometimes there were things like you mentioned, giving away things, almost like, I'm not planning on a future, so I don't need this. Things like that. So I've seen various kinds of behaviors that may be disturbing. But now there have been a couple of cases recently in the news where someone, maybe they had been on medication, maybe hadn't been taking their medication. Something happened. Anyway, they were having a psychotic episode and the family didn't know what to do. So they called police. Well, the police responded the only way they know how, with deadly force. They're trying to subdue the person, and the person ends up getting shot and killed. And now the family's all upset and saying, "Hey, you killed our loved one." Yeah, but you called us and you couldn't handle it. So what do you want us to do? So I don't know if there is a special training that police have when dealing with mental illness, but is there a way to prevent that sort of thing? I mean, are there other agencies or somebody else you can call if you need help with somebody who's out of control other than the police? Or is there some kind of way you can let them know this is a mental illness episode? What are some other ways we can respond when somebody is mentally ill but possibly dangerous because they're not in their right mind?
So thank you for asking. That's really important too, because what I'm hearing is they're past a controllable state. And a lot of times when a mental health patient is going through something in the home environment, the family is not prepared, or maybe they ignored the signs of noncompliance. Those medications are so important to keep that person well controlled and stable. And so when medications are not being compliant to, they're not going to appointments, those are some important things to consider, that, hey, he's not taking his medications or she's not taking the medications. We should be calling the primary doctor that handles the psychiatric medications, following up on what could be done, and also having handy numbers near the refrigerator or whatever it is that you do in your home. Keep those important factors and numbers at hand. When it gets out of hand, yes, you do have to be safe, because they can be aggressive out of nowhere. You will not see it coming all the time. So that's why it's important to catch it early versus waiting till it's gone beyond its control. If you're going to call the authorities, I truly suggest asking for a crisis team. The crisis team would be better because they can handle the situation. And I would say definitely make sure it's on the dispatch recorded. When you call, I need a crisis team, describe the event, describe the person's condition so that they know this is not someone being aggressive out of nowhere in society. This is a person that's mentally ill. That changes the whole tone of how they should be approaching the home, and they have a skill set to do that. But I think versus calling and just saying, I need the police, that changes how they're going to come to the home, because you're describing more of a aggressive event without giving pertinent information that they need to know to handle the situation, and also being present for that loved one. You know, if you know that they're in a home by themselves and you're scared, maybe the best thing is to be there at the home. But if you can't go on the inside, at least you're there to kind of manipulate the conversation of what needs to be said to the authorities.
No, that makes a lot of sense. And I think a couple of cases I've read where they sent the police to the home and were not there to explain that this was a crisis, and as a result it ended tragically. So I would assume that most cities have, you know, a crisis center, or, you know, the crisis squad or whatever that would need to come out and handle that, as opposed to the regular police that are coming to address a crime or criminal behavior, or what they perceive as potential criminal behavior. So where should a person be taken when they're in that state? Is a hospital where they really should go, as opposed to jail? Because a lot of times that's what happens. If once they do subdue the person, they end up taking them to jail, which they don't get any help. Because
it should be through the ER hospital, and they need to be evaluated on what caused the behavior. And this is where it's really important, like I said, for medications to be written down, case management discussions and reports from them as well on what was done for the patient prior to the last discharge, and also having power of attorney over health information set up already. There are actually documents that you can have set up legally if you are caring for a person that has a mentally impairment. And so it's important to have that documentation, because that's more proof on your support on what's actually going on with the patient, how the plan of care should go. So you really can get involved if you allow yourself to become an advocate for yourself to support the person that needs your help.
Well, I do think that that's a critical thing, especially, you know, when you have so little information, so little understanding about mental health and mental illness. And sometimes people don't know who to call. Now there's this website, of course, and you can always Google help for mental illness. There tends to be different agencies that you can call depending on what city you're in. I wouldn't say 911 would be the number, because that is, you know, the police emergency, but that's the police. So is there a number other than a 911 that would get you to the crisis hotline or something like that, where they would send out a different team of people that could get that person to an emergency room? Or is there something people should say to describe the situation so that the right team of people come to the mental health people who can get them to a hospital, as opposed to police with guns taking them to jail or trying to subdue them, put them in handcuffs and all of that? What are the words people should say if somebody's having a psychotic episode, so they get the right kind of help?
So I would again ask for the crisis care team and make sure it's recorded, and describe the event of your loved one. You can mention that my sister, my brother has a history of schizophrenia. He hasn't been compliant with his medications. I believe this is a acute aggressive episode. He's been fine up to this point, and I'm concerned he may harm himself or others, but it is due to his mental illness. If you describe in detail what's going on, that should help a lot on their end on what's going on. I would even say he doesn't have any weapons on him or her. Describe what he's actually doing. Describe how you should approach the home. He or she doesn't like loud sounds. Whoever comes into the home may have to use a calm voice and speak to the person. because this person has a trigger for this. If you lay down the whole blueprint of what's going on with that patient, they should have a visual of what they're walking into.
Well, I think that's important to emphasize, especially if they don't have a weapon, to let them know they don't have a weapon, you know.
Yes.
Now, if a person picks up, say, a butter knife or something, then that becomes a weapon. I don't know. But if it's a crisis team that's there, they'll respond differently even to that. And definitely it's different if a person does not have a firearm, which can do harm over distances as opposed to a knife. You got to be up close. So I would imagine the response to that would be different. But now I'm also seeing a lot of changes in behavior with people that have Alzheimer's and dementia. We're going to take a quick break and come back and talk about that, because that's one of those age-related things that people sometimes seem to think it's inevitable. You know, it's inevitable that you're going to have a decline in your mental facilities I mean, that's been accepted, but is that really something that is unavoidable? And do we treat that as mental illness? So we talk about it when we come back, and we appreciate your comments. So feel free to write in your comments, and we will gladly share them with our viewing audience. And we appreciate the fact that you are willing to learn some things so that you can perhaps respond differently to your loved one who may be suffering mental illness. So we'll be right back after this quick break. We're going to greet our global audience watching us from all around the world. So stay with us.
We are global transformers, changing the world from the way it is to the way it should be. We are one. Wherever we live on this earth, we are one human family. On behalf of our team of radio hosts, I'd like to extend a greeting to all the members of our family, whenever and wherever you may be listening around the world. To our family in China, Ni Hao. In India, Namaste. In Japan, Konnichiwa. In Korea, Annyeonghaseyo. In Russia, Zdravstvutie. In Germany, Guten Tag. In Poland, Dzień dobry. In France, Bonjour. In Spain, Hola. In Italy, Ciao. In Egypt, Ahlan wa sahlan. In Ghana, Akwaba. In Nigeria, Peleo. In South Africa, Sawubona. In Senegal, Nangadef. In Kenya, Jambo. In Israel, Shalom. In Pakistan, Afghanistan, Palestine, and Saudi Arabia, Assalamu alaikum. Greetings, and may peace be upon you all. Join us live on the on-air radio network. Call 727-731-5192. We want to talk to you.
Yes, we do want to talk to you, and we want you to talk to us too. Feel free to write in your comments as we continue to explore this, which is Mental Health Awareness Month. And we are here with our guest, Rachelle Mitchell, psychiatric mental health nurse practitioner, to give us some practical information on how we can handle those who are going through a mental health crisis. So I've had relatives that experienced some of the age-related signs, such as Alzheimer's, dementia. You know, it's beyond maybe just, you know, slight forgetfulness, and it can escalate to just where they totally don't remember anybody. You know, I've had friends, you know, I've seen the progression. Is that considered mental illness? Things like Alzheimer's, dementia, has it been classified in the mental illness arena?
That's more of a neurological disorder that affects neurotransmitters as well. So the brain is amazing. Anytime there's an imbalance or a part of the brain that's not working properly, my whole point is to show the public and society that a lot of these illnesses or diseases, or whether it be neurological or mental illness, some of it is triggered by your own brain or genetics and environmental factors. So with Alzheimer's and dementia, that's more neurological. What's happening with the brain is that it's not enough acetylcholine. And so the medications prescribed help increase the memory and help. So ACH is acetylcholine is a neurotransmitter that helps with memory. So of course, with Alzheimer's, you see a decrease in motor function, activities, decrease memory, of course. And so the medications help with that. And one of the medications that helps with the early onset of Alzheimer's is Namenda. The only thing is, families should be educated on the fact that it works only for like 3 to 6 months. Yes. So what happens is after that, you'll see a deterioration in their memory. You'll see this sudden decline in their thought process. So that happens, and you'll see a further decline in behavior, memory, thought process, motor skills, and in their activities and appetite. That's usually what happens.
So according to our current philosophy on the treatment of these kind of neurological caused mental deficiencies, are these things such as Alzheimer's and dementia considered curable and reversible, or is it expected that these will just progress until a person passes away? What tends to be the expectation in the medical field when it comes to these kinds of illnesses?
So in my experience and knowledge, it's not reversible. It will continue to deteriorate. And unfortunately, it depends on the person. Some people's Alzheimer's dementia is very fast. Some people can go 10, 15 years and have no changes. And then all of a sudden, you see drastic changes. So everybody is different, but it is not reversible. At this time, it is not curable, but the medications just help stabilize what memory and function they do have. And that's pretty much what we do.
Yes. And I want you all to feel free to write in your comments because there are different schools of thought that are arising. Now, you mentioned some of the things, vitamin deficiencies, and I've known cases where people have been deprived of essential vitamins, and it has had an impact on their neurological function. And then when those vitamins and nutrients were added to their diet, they regained a lot of their neurological functions. So we know that unfortunately our medical industry and our nutrition industry have not had the marriage that would probably make us better people, because so many of our illnesses have to do with deficiencies in our food supply and all those things, the preservatives that we eat over time that create problems. So is there research that has been done that shows a specific kind of, as far as you know, a specific kind of diet that is rich in certain kinds of things can probably prevent things such as Alzheimer's and dementia, or even reverse it based on getting you the right kind of health support for your brain? Have there been studies about that, to your knowledge?
To my knowledge, it's just basically lean meats and healthy fruits and vegetables, staying away from fatty foods, fast foods, your salts, but mostly with dementia and Alzheimer's, that has to do with a protein plaque in the brain that also causes that problem. So healthy eating does help. There are studies that show if you are active in your life and reading, some people doing crossword puzzles and brain activity games, those are said to help out. And also your B12 vitamins and so forth, those help too.
Now, what about people who, and I understand that when you get drunk, you kill brain cells, which aren't replaceable. That's what I've always heard. So people who may have had periods in their life where they binge drinking and maybe killed a lot of brain cells, and then you start to see some decline in motor skills and other things, speech patterns that indicate that there's been some neurological damage as a result of substance abuse. Are those things treatable? Is it possible, or is it considered maybe reversible or not? Is it more or less when a person is coming to the hospital with those kinds of signs? What is generally the strategy to treat that? Is it medication to keep it from escalating? Is it nutrition to maybe help? And I don't know if you rebuild brain cells. I don't know, but what tends to be the way that is handled? Because it's neurological, but it's damage based on behavior that they engaged in.
So if that's someone who was dependent on substance for years with a choice of alcohol, the main thing would be to preserve the liver as much as possible by looking at what medications are safe to give. Because at this point, we would try to preserve liver metabolism and also kidney function. So those two are the things that we would look at. And the choice of medications will be dependent on our labs that we see and so forth to help us determine what's the best medication. There's not really anything or particular treatment for that, because if they're going through withdrawals, then we will treat that with IV fluids, anti-anxiety medications to keep the person calm, because then they're at risk for seizures. However, there's not one particular plan that we always just stick with, because it depends on how the patient is presented to us. And most times the dementia, you are correct, they are burning or destroying brain cells with alcoholism. You are correct about that. However, the goal would be to stabilize the patient as much as possible, but we can't reverse the damage.
Ooh. Okay, if you're a heavy drinker, think about that. You might want to stop. So now, in terms of what is diagnosed as mental illness, is that covered by medical insurance generally? I don't know if that's within the realm of what's covered with medical insurance now.
Most insurance plans will cover it. I can't speak to which ones do, but I haven't seen a problem, especially with them coming to the hospital. We know that they come repeatedly. It just depends on the carrier that they chose. I can say to the public, be mindful when you are choosing an insurance. Ask those good questions about what do they do for this particular situation if you're admitted to the hospital. Try to do a little bit of research to see if there's any biases towards your diagnosis prior to getting with that provider that you choose for insurance. But it's a possibility, yes, they do cover mental health illnesses. It just depends on which one you have chosen.
Now, does it also determine, is it also influenced by what particular type of mental illness, just schizophrenia, bipolar disorder? I mean, the label that we put on it, does that also determine whether or not it's going to be, your treatment is going to be covered by insurance?
I can't speak to that, but I can say some of the populations come from a more poorer population, so they might not even have the type of fancy insurances that we think of. It's usually like Medicare and Medicaid type of situations. So that I do see.
Yeah, that I tend to see that a lot of low income people do not get care for their mental illness. A lot of the homeless population, they're there because of mental illness. And I don't remember what year it was, but I remember there was a year when it was just decided that many of the facilities that were housing them couldn't afford it anymore. So it's like they just opened the door and said, look, get out. We can't take care of you anymore. And a lot of people who had mental illness were just on the street, and that still exists. And apparently they don't have coverage to care for them.
Right.
So that's having a major impact on the society, because you walk down the street and you see somebody talking to themselves. They don't have an earpiece on, so they're not on the phone.
Yes.
And I see people cross the street like, this is crazy. So there's still that fear of the mentally ill and the stigma that comes with it. So we're going to take our last break, and when we come back, I want to take a look at the stigma that is still carried by mental illness and how we may get beyond the fear of those who are mentally ill and the stigma of admitting one needs help for mental illness. So we will be right back after this last break. So stick and stay, don't stray away. You are watching the On Air Daily News Hour here on The Female Solution, and our guest is Rachelle Mitchell, who's giving us some real insight about mental illness. So we'll be right back after this last week, and we want you to just stay with us.
Leaders of nonprofits empowering worlds. Let's go.
But the vision that God gave me, I felt that it was time for me to step out and work on the vision that God gave me.
We need look no further. We have a unique voice. We have a unique talent pool.
Peace and love. Peace and love. I'm Michelle Renee, host of Education Nation, live on the Female Solution Global Network every second and fourth Sunday from 12 p.m. to 1 p.m. The intention of Education Nation is to raise awareness about the literacy crisis and to offer information to combat the problem. The goal is to awaken an army of reading coaches and mentors. You will experience guests who are doing their part in the community to ensure youth in their circles are reading and thinking critically. I look forward to serving you in this capacity. Literacy is freedom, and Education Nation will offer information and strategies to help ensure our young people stay free.
And we are back. You are watching the On Air Daily News Hour here on the Female Solution Global broadcast. And July is Mental Health Awareness Month. And we are aware that there are many among us that are battling mental illness. And as a result, they're often shunned by the society. They're often criminalized by law enforcement. And they're often feared by people who encounter them on the street, especially because it's unknown how someone is going to behave. And if they appear to be delusional, you don't know if they're going to react to something in their own mind and attack you. That is often the fear. So when we take a look at mental illness and the idea of someone not being in their right mind, there's still a stigma attached to that. There are a lot of things that people go through, hearing voices. Maybe they might even be having spiritual visions or whatever, but you hesitate to talk about that because it's attached to mental illness. You're seeing things nobody else is seeing. You're hearing things nobody else is hearing. So people hesitate to describe anything that's out of the norm and what's accepted by society. And then there are people who may really have some emotional breakdowns, some mental challenges, maybe some neurological damage, hit in the head or whatever, and whatever could have happened, amnesia, whoever, whatever mental state, but there's a tendency to hide it because of fear that they will maybe lose a job or whatever the case may be if they appear to be less than mentally stable. How can we overcome the stigma of mental illness so that if someone is concerned about their mental health, that they can openly seek treatment without losing job status or whatever the case may be, in which it's felt that you need to be mentally stable to do this work, or you need to be mentally stable to hold this position? How do people just openly get help without the stigma? Is there a way?
There is a way. So people often fear what they don't understand. And it starts with the providers. We need to educate the families and the patient and whoever's involved in the plan of care. It's no different than educating in a discharge moment about congestive heart failure. You would explain to that family their condition, the reason and rationale for the medications. So for some reason, like you said, I appreciate you making those great comments, because it is true. The stigma is out there and they know that they're being judged. However, as much as we say that they're not alert, there are quite a few patients I've taken care of that are alert and know what's going on while they're hallucinating. And they can hear what you're saying about them. They can hear the comments being made. But it starts with the community. It starts with families. And it starts with education. That's how we can get that out to support. It starts with us.
Now that's funny you say that people can hear you talking about them. I have seen people in a room with someone who they presume was mentally challenged, going through some type of mental illness, and saying things as if that person is also deaf, and saying things like they can't see that. That's not helpful. So,
right.
I know that in some
so we
areas,
need to.
Yeah, you're right. We need to not do those things. And I know in some areas they have even, I guess, I wouldn't say reprimanded, but reminded some comedians not to make statements about mental illness in a way that is insulting, in order to sensitize people to it. Some comedians have complied. Some like, hey, that's part of my routine. We laugh at that. Yeah, they crazy. So what? I don't know. Is that also one of the things culturally we need to address?
Yes.
Make fun of it?
Yes. Culturally, we are hearing or seeing what the movies say about schizophrenia. The movies with the needles, giving someone some antipsychotic, and then they're out, gone to sleep. When people see that, they assume that's what's going on in the hospital, or they don't want their loved one to go there because they're going to give them this to sedate. And that's usually not the case. We have parameters before we can give medications. And they need to know the most important thing, they have legal rights as well. Mental health patients have legal rights. There are a lot of things that people aren't even aware of, that when they're discharged, they have things in the community to prepare them for the transition, because the court systems are recognizing that, hey, this patient may not have to stay in here a whole 6 months in an inpatient hospital unit. Let's get them to an assistive day program. And the day programs allow these patients to go home and be treated by case managers, following up with them to see how they're doing in society. Are they taking their medications? Are there new onsets? So there's a lot of things happening that people don't even realize that's going on in the community for the benefit of mental health patients. They have legal rights and respect that should be given to them as well. But when you fear these patients and you're going by what grandma said about Uncle Joe or something you've seen in a movie, you often would get those stares. Why is she acting like that? Why does she do this? Or why does this happen? And again, people fear what they don't understand, and they don't empower the moment to go and support that patient or loved one and find out what's causing that. So this whole entire segment, I talked a lot about neurotransmitters, because that's basically the basis of some of the mental illnesses. That's my way of sharing that it's out of your control most times. You can be perfectly normal, and all it takes is an imbalance of a neurotransmitter and the right environmental factor that challenges you, and you can be depressed, you can be anxious. But the stigmas are from what people think and what they want to share about their fears about the mental illness.
Yes. Well, I think that many of the people who have encountered those who are expressing, obviously, mental imbalance, because it's not talked about, in families, or we will tend to be ashamed. Sometimes that keeps people from coming forth to either seek help for themselves or another, because of the shame factor. And it shouldn't be something that we're ashamed of, because an illness is an illness, whether it's a physical. I mean, you wouldn't be embarrassed if you having chest pain to say, oh, I don't want anybody to think I have a heart attack. I'm embarrassed to say anything, sit there and die because you won't get help. But a person who is knowing that they're maybe feeling anxious or just overly distressed, long time depressed, suicidal.
Yes. And let's not forget about our maternal new baby mothers as well. Postpartum is so huge, and people don't understand. They may say, why isn't she not taking care of the baby? She's not a good mother. And that's not true. If you understand the dynamics of what happens during a pregnancy, with multiple hormones out of balance during a pregnancy and post-pregnancy, that puts the patient at risk for depression, and it should be screened a lot better in these hospitals prior to discharge, and monitor the relationship with the new baby and the mother. How is she responding to the child? Those are important factors, without judging the mother, making her feel comfortable to say, you know what, I don't feel right. That's how you save the mother. That's how you save the baby. You can't judge. You have to evaluate and respect what's going on. So when you see and hear these stories, it makes me wonder, how much was evaluated in the hospital? How much time did someone take to monitor the reaction and the relationship between the newborn and the mother? So also multiple pregnancies. If you think about the imbalance of the hormones, most women need 1 to 3 years to heal post the pregnancy. But if you have another child, now it would be up to that OB to say, we'll monitor. Let me know if you start feeling like this. It's a second, third baby, those type of things. So those are important. But the ridicule and the judgment is on the parenting scale, which shouldn't be occurring. It should be on what's happening with the mother.
Yeah.
So that's how you earn your trust.
Yes. I definitely appreciate you saying that. As someone who's had a child, hormone imbalances, this is a real thing, and we should not be condemned for something physical that's happening that is going to affect our neurological state and our emotional state and everything else. So we're grateful that you came on to give some clarity about something that is so pertinent. This is Mental Health Awareness Month, July, and go to the On Air Daily News, onair.dailynews.com. We've talked about this and encouraging you to look up those crisis hotlines in your city. If you or someone in your family is going through a mental health crisis, get them help, get them the right kind of help. Call the people who are going to come and help them manage a crisis and not criminalize them while they're not in their right mental state. We want everybody to stay safe. So thank you so much. We appreciate you so much, Rachelle Mitchell, and continue to do the great work you do. And we look forward to having you back as we continue to educate on mental illness. And
thank you.
And you all come on back tomorrow morning, because we're going to be here with Mushepsut and Master Force, always giving us a way to master our mind, heart, body, soul, and spirit. And until next time, we want you all to continue to shine your light. See you next time. We've come to the end of our show today. If you missed any broadcasts, go to our website for the audio and video archives at www.thefemalesolution.com. On behalf of our team of radio hosts, I'd like to thank all of you who participated in today's discussions. And to our global family joining us from all around the world, we say thank you. To our family in China, xie xie. India, dhanyavad. Japan, arigato. Korea, kamsamnida. Russia, spasiba. Germany, danke. Poland, dziękuję. France, merci. Spain, gracias. Italy, grazie. Egypt, shukran. Ghana, madasi. Nigeria, eshe. South Africa, ngiyabonga. Senegal, jaref. Kenya, asante. Israel, toda. Pakistan, shukriya. Afghanistan, tashakur. Saudi Arabia and Palestine, shukran. Assalamu alaikum wa rahmatullahi wa barakatuhu. Thank you, and may peace be upon you and the mercy of God and God's blessings.